How are you, Mr. Stevenson?
Oh, I'm doing fine.
Can I look at your arm? This area looks a little bit dry. Does it itch?
Well, now that you mention it, it does itch some.
It's a little warm to the touch. Is it sensitive to touch?
Well, only where I scratched it real hard.
Okay, I'm gonna make a note and have the nurse look at it later also.
Maintaining healthy and intact skin is crucial to the overall well-being of the residents under your care. You can help maintain resident skin health through routine skin care, helping identify skin disorders so they can be treated properly, and preventing existing conditions from getting worse. In this program, we will look at why it's important to maintain healthy skin. We'll review the normal effects of aging on skin's function and appearance to help you distinguish between normal age-related changes and those changes that are due to skin disorders and breakdown. We'll also review some common skin disorders that you might see. Then we'll describe a tool called the Skin Check. You can use it to screen for skin changes and problems. Finally, we'll review routine skin care, including your role in the prevention of skin disorders and your responsibilities during treatment. Let's first look at how you can help residents maintain skin health.
I think you should take a look at Mr. Stevenson. I found a dry spot on his arm that seems to be itching him a lot.
Okay, I'll take a look.
Okay.
Are you aware that the skin is the human body's largest organ? Adult skin covers roughly 20 square feet, which is just under the dimensions of a single fitted bed sheet. The skin also makes up about 16% of a person's body weight. The skin is an elastic, waterproof covering that protects the body from damage and guards against bacteria, chemicals, water, heat, cold, and sunlight. It constantly renews itself. Normal skin cells replace themselves every month. Skin is the body's first line of defense against invading viruses and bacteria. The skin produces immune cells that help fight against disease. It uses sunlight to make vitamin D, a nutrient essential for health and now known to be important for preventing cancer. Skin helps control body temperature. When temperature exceeds 98.6 degrees Fahrenheit, the body perspires. The moisture then cools the skin as it evaporates. These functions are vital. Healthy skin keeps residents comfortable, helps prevent illness and unnecessary treatment, demonstrates your high-quality care, and helps your facility meet state and federal regulations. Every older adult's normal skin appearance is different. Some have more wrinkles or age spots. Others show dryness and scaling. Some have moles, scars, birthmarks, or even tattoos. Know what is normal for each of your residents so you notice when something abnormal appears. Let's look at some normal age-related skin changes. As we age, the skin becomes thinner, less elastic, and more fragile. Your older residents' skin becomes more vulnerable to injury, skin tears, irritation, and infection. Healing may also be slower. Older skin renews more slowly. By the age of 80, the turnover for new skin cells can decrease by as much as 50%. So when skin wounds appear, they can take longer to heal. Some residents suffer from dry skin or xerosis, most often caused by a reduction in skin water content and decreased oil and sweat gland production. The skin of your older residents can become dry and scaly. Dry, scaly skin usually itches. Routine skin care can include using moisturizing lotions to soothe itchy skin and keep residents from scratching. Older skin is less elastic, increasing the risk of skin tears when your residents are moved or repositioned. With age, we often lose some of the fat that provides cushioning just under the skin. Without this protection, some residents may be at increased risk for developing pressure ulcers over bony areas. Because this fatty tissue insulates the body, some residents may also be more sensitive to cold temperatures. The appearance of the skin also changes with aging. Skin structure weakens and loosens. Tissue sags and wrinkles appear. You may also notice normal changes in skin color. With advancing age, skin pigment distribution and concentration can become unequal. Aged skin may look patchy. Age spots may appear. Skin may even look pale because fewer blood vessels reach the layer just below the outer layer of the skin. Beyond normal aging, other factors may affect the skin health of your residents. Sun exposure and smoking are two of the most common issues. Both can change skin appearance and structure. Exposure to the sun's ultraviolet or UV rays can damage skin. Sun exposure causes the skin to thin, increasing the risk of skin tears and easy bruising. UV rays also increase the risk of skin cancers. Tobacco smoke affects the appearance of skin in a number of ways. The skin's color becomes a yellowish gray. Tobacco smoke constricts blood vessels, reducing blood flow, and causes skin cells to die from lack of oxygen. Smoking destroys vitamin C that the body needs to keep the skin firm and resilient. Reduced blood flow and the destruction of vitamin C contribute to wrinkle formation, especially around the eyes and mouth. Normal skin can be different for each of the residents in your care. That's why it's important for you to understand what's normal for each resident that you care for, so you'll be able to quickly spot skin changes that need to be reported. Next, let's look at your role in routinely examining your resident's skin.
Okay, Mrs. West. Let me quickly check your skin and we'll be all finished.
Okay.
Normal is your baseline, based on what you observe and know about your residents. Comparing is the best way to notice skin changes. Here's a handy way to do that: the SKIN check. Talk with your supervisor to see if your facility already has a method for observing skin change and skin health. If not, the SKIN check may work for you. Let's look at the SKIN check. Follow each step to obtain a baseline and use this baseline for comparison in routine follow-ups. Here, we use a checklist of skin health issues to observe.
Miss West, may I check your arms?
Oh, yes.
Is there any itching today?
I don't know.
Okay. Looks good.
Scan. Scan your resident's entire body, looking for any of the following. Note your observations and report them to your nurse.
Okay, I see they made a note of that dry area. Looks like it's getting better.
It definitely feels better.
Know and compare. Know what is normal for your resident. Compare what you observe against what had previously been documented. Make note of areas that have changed from the last assessment.
There's no mention of this red area. How does it feel?
It's just a little itchy. Oh, it's just a little red. It's nothing.
Oh no, let me tell the nurse about it so she can have a look at it.
All right.
Don't want anything happening to that.
Indicate. On the checklist, indicate the area of the body where you notice skin condition changes. Describe what you observe, the skin appearance, in detail.
All done, Mrs. West. That was okay, wasn't it?
Oh, it was fine. Thank
Great.
you.
Notify. Notify the nurse of what you observe. Share the checklist. Following the SKIN check or other skin assessment tool, routinely recheck residents to help them avoid skin problems or to monitor those problems that are being treated.
How are you feeling today, Miss West? What did the nurse say about that itchy spot?
She said it's a good thing we caught it. Seems I had a reaction to that new laundry detergent.
It happens. Sometimes we become sensitive to chemicals we've been using our entire lives. We're getting in a supply of hyperallergenic detergent.
Oh, thank you.
Next, let's look at your role in skincare.
Good afternoon, Mrs. Clearly. How are you this afternoon?
I'm fine, dear, but I do need to use the bathroom.
Oh, here, let me help you.
Thank you.
Incontinence can increase the potential for skin disorders. Wetness and bacteria can damage skin. Incontinence creates a moist environment where bacteria can build up. Exposure to moisture and harmful compounds in urine and stools can irritate and break down the skin, causing a condition called incontinence dermatitis. When you observe incontinence, you can help protect skin by following these 4 guidelines. Be aware of toileting needs. Check incontinent residents regularly. Use barrier ointments and pastes. And change bedding regularly. First, be aware of your residents' toileting needs. They may need adaptive clothing or specialized equipment. Here are some suggestions to consider. Use easy-to-remove clothing. Provide signs or verbal reminders to use the bathroom every 2 hours. Place a portable commode in the room if a bathroom is too far away. Use incontinence products. Provide a toilet seat raiser with arms if a person has difficulty getting on and off a low toilet seat. Place a sign with simple instructions next to the toilet. Use a colored and padded toilet seat that calls attention to the toilet. Remove the toilet seat cover. Secondly, check incontinent older adults regularly. If they are soiled, gently cleanse the perineal area. Use special perineal cleansers. They are especially formulated to gently remove urine and stools and to eliminate odor. Use a soft cloth to avoid irritation. Then gently and thoroughly rinse. Condition and protect the skin to prevent further exposure to moisture, irritating chemicals, friction, dryness, and bacteria. You might need to use skin barrier ointments and pastes. They protect the skin against chemicals and friction. Some also contain moisturizing ingredients. Finally, change clothing and bedding frequently to reduce bacterial buildup and to keep residents dry and comfortable. You may also be responsible for assisting in the prevention of skin disorders by applying moisturizers, monitoring dietary intake and hydration, and properly positioning the older adults that you care for. Routine skin care is your daily responsibility. Since you have daily contact with your residents, you play an important role in treatment and prevention. The 5 keys to the prevention and treatment of skin disorders include proper nutrition and hydration, bathing, moisturizing, positioning, and, most importantly, awareness, including routine skin checks. A healthy diet contributes greatly to healthy skin. Proper nutrition and hydration supports the skin's immune response, facilitates healing, helps prevent dryness, and helps prevent skin breakdown. Residents can develop skin problems when they're not receiving adequate nutrition. Nutritional deficiencies can result from underlying disease or as a side effect of medical therapy. In either instance, the nurse or facility dietitian may find it necessary to provide nutritional supplementation. Your role is to observe and report when residents are not eating well, and to consult either a nurse or a dietitian if you have concerns regarding a resident's nutrition. You can also note a resident's fluid intake. Regulations state that residents should have a minimum of 1.5 quarts or about 6 glasses of fluid daily. Make a point of reminding your residents to take a sip of water or another beverage whenever you see them. Everyone in the facility can take a role in reminding residents to stay hydrated. Regular bathing removes soil, bacteria, and irritants. It keeps residents clean and comfortable. But bathing can also dry the skin, especially when you use warm water. Some residents may only need bathing every other day or even twice a week to prevent skin from drying out. Review and follow your facility's bathing schedule and protocol. When bathing your residents, avoid using perfumed soaps. They may contain alcohol or other substances that can irritate the skin. Use antibacterial soaps or mild soapless soaps, such as Cetaphil. Mild soaps can affect the normal and healthy acidity of the skin, so rinse thoroughly and only cleanse when necessary. Ask family members about the soaps and moisturizers that your facility provides. They may know what their loved ones prefer and what they can tolerate. Because of the weakened and fragile state of aged skin, older people are at greater risk for cuts and skin tears. What may seem like a gentle bump or rubbing against something that probably would be harmless to younger skin can cut or break skin on an older adult. Open areas can be painful and lead to secondary infections. Be careful of friction caused by rolling and moving residents across bed sheets. Rubbing skin with towels or blankets can also cause skin tears, cuts, or contact dermatitis that resembles rug burn. Take proper care in positioning and repositioning to prevent skin tears. Review your facility's guidelines for moving your residents. Your attention is the key to effective skin care. What you see, what you observe, and the notes you share are crucial to the skin health of your residents. In this program, we've discussed skin health and how you can help maintain it, the skin check, and your role in treating and preventing skin problems. Be aware of any unusual changes to head off skin problems before they develop, and work with the nursing staff in your facility to treat skin problems. Observe the changes in an individual's skin. Notice the irritants they may come in contact with, and be familiar with their bathing routine. Follow procedures to keep residents dry, taking care to position them properly, and helping keep their skin moisturized. Be aware and share what you observe. You can help your residents maintain good skin health.